Hello, my name is Dr. Diwan S. Raja. Today I will discuss about the anatomy of the axillary artery. The axillary artery is a continuation of subclavian artery. The axillary artery is a continuation of subclavian artery so this is subclavian artery and this is the axillary artery. The axillary artery is a continuation of subclavian artery at the outer border of the first rib. This is our first rib. First rib is the outer border. Here we have the axillary artery. The axillary artery extends up to the lower border of the teres major muscle. So axillary artery extends from here up to here. This is axillary artery. It continues as axillary artery from the outer border of the first rib. It is a continuation of subclavian artery. Then it continues as the brachial artery. This is the brachial artery. We got the extent of the axillary artery from here to here. This is the axillary artery. This is subclavian artery. This is continued as the axillary artery. Axillary artery continued as the brachial artery. Now we'll find out the branches of the axillary artery. Branches of the axillary artery. Axillary artery is divided into three parts by the pectoralis minor muscle. We'll go there very soon. Pectoralis minor muscle that divides the axillary artery into first part, second part, third part, which is behind the pectoralis major, that is the second part. What is proximal to the pectoralis major, that is the first part. Just beyond the pectoralis major, that is the third part of the axillary artery. We'll go to the branches of the axillary artery. We have a mnemonic like that. Science teachers love sky astronomy and physics. We remember that. We may find out the branches easily, like science stand for here, superior thoracic artery. Superior thoracic artery, then thoracoacromial artery. Okay, then we'll go lateral thoracic artery, lateral thoracic artery. Okay, then subscapular artery. Okay, S. Then we'll go to the anterior circumflex humeral artery, and then posterior for physics, posterior circumflex humeral artery. Okay, we got that. So we got the branches of the axillary artery, superior thoracic artery, acromiothoracic artery, lateral thoracic artery, subscapular artery, anterior circumflex humeral artery, posterior circumflex humeral artery. Now, from first part we have one artery, that is from the first part. Okay. From second part we have two arteries from the second part of the axillary artery, that is behind the pectoralis minor muscle. This is the pectoralis minor muscle. Then from the third part we will get these three branches from the third part. So you can easily remember: first part one artery, second part two artery, third part three artery. First part superior thoracic artery, then thoracoacromial artery, then the lateral thoracic artery, okay, subscapular artery, anterior circumflex humeral artery, posterior circumflex humeral artery. Okay, we got science teachers, lab, sky, astronomy and physics. Now we'll go to the branches, important branches of these arteries. Okay, so what are the branches of the thoracoacromial artery? Okay, we'll go there. Branches of thoracoacromial artery, thoracoacromial artery. Okay, if we just put our hand on the shoulder, we'll get four branches that should come from the thoracoacromial artery. We'll get four branches. We have four branches here, and from first part we have the superior thoracic artery. Okay, from the this is thoracoacromial artery. It has branches like that of the, if you just put your hand on the shoulder, you get like this: acromial branch. Okay, it has deltoid branch. Okay, pectoral branch, and another one is the clavicular branch. So if I put it here, I have deltoid muscle, pectoralis major muscle here, acromial process here, acromial branch, and the clavicular branch. Okay, these are the branches of the thoracoacromial artery. So if you like another mnemonic like that of circular pad, okay, then we get that C for the clavicular, P for the pectoral branch, okay, A for the acromial branch, okay, D for the deltoid. Okay, science teacher has a circular pad for his computer. Okay, you may remember that way. Okay, we got the branches of the thoracoacromial artery. Then we have to go out find out the branches of the subscapular artery that is coming out of the third part of the axillary artery. Branches from subscapular artery. Subscapular artery is the largest branch of the axillary artery. There's two branches. One is the circumflex scapula. Okay, that take part anastomosis around the scapula with that of the thoracodorsal artery. It is another branch. Okay, thoracodorsal artery. Okay, these are the two branches, and this branch take part in the anastomosis around the scapula. Okay, with that of the suprascapular artery, and also from the descending branch of the transverse cervical artery. Okay, and certainly with the thoracodorsal artery, we got the branches of the subscapular artery. So these are the branches of the axillary artery. Relationship: this part is related to the skin superficial fascia, the pectoralis major, deep fascia, clavipectoral fascia, structures piercing the clavipectoral fascia anteriorly. Posteriorly, this part is related to the first intercostal space, external intercostal muscle. Okay, and communicating branch between the lateral medial pectoral nerve. This part, it is under cover of the pectoralis major. It is anteriorly related to the pectoralis skin superficial fascia, pectoralis major, pectoralis minor. Third part, again skin superficial fascia, and we'll also get posteriorly the muscle, the subscapularis muscle, teres major, latissimus, dorsimus, it will be posteriorly. If you look its relationship to that of the brachial plexus, then in the first part we have the lateral cord laterally, posterior cord partly laterally, and with the medial cord here. As it goes down, we get the musculocutaneous nerve laterally, the third part of the axillary artery, ulnar nerve. Okay, this is the median nerve. Okay, this is the musculocutaneous nerve, and this is the ulnar nerve. Okay, ulnar nerve, and we have to remember that the axillary vein is medial to the axillary artery. That is the axillary vein, and certainly this is the pectoralis minor. Okay, these are the relationship in a nutshell. Okay, so we'll go to some of the clinical anatomy. Okay, clinical anatomy here, we have to mark that. Okay, this is the teres major muscle. Okay, teres major. This is the pectoralis minor muscle. This is the medial lip of the bicipital groove where it is inserted. This is the first rib outer border. So again, the landmark, outer border of the first rib, lower border of the teres major. Lower border of the teres major, divided into three by the pectoralis minor. Now we learn some of the clinical anatomy. Clinical anatomy. Okay, first part of axillary artery may undergo aneurysm. Aneurysm, that is the abnormal dilatation of the blood vessel aneurysm, okay, in baseball pitchers. Okay. Then third part may be compressed. Third part of the axillary artery may be compressed to decrease or stop hemorrhage, okay, may be compressed against the surgical neck of the humerus, against the surgical neck of the humerus to prevent hemorrhage or to block hemorrhage or bleeding. Okay. Another relationship, just before concluding, I must say, the third part branch, anterior circumflex humeral artery, posterior circumflex humeral artery, they actually encircle the surgical neck of the humerus. Okay. So if there is any type of fracture of the surgical neck of the humerus, we may have damage to those branches also. Okay, we got that. So that's all about the anatomy of the axillary artery. If you have any question, please feel free to ask me. Please share the information with your friends. Please support my channel. Please subscribe me. Have a nice day. Bye now.